and joining us now as our keynote speaker. So welcome, Commissioner. Delighted to have you with us.
I'm delighted to be able to join you, Kathy, albeit virtually, and to really be part of this very important EU Health Summit, appropriately, I would say, call time and call for action. And it's nice to be able to be part of a huge team that I have come to work very closely with over the last few months in this unprecedented health crisis. So it really has been a wake-up call for all of us. And COVID-19 has amplified, I would say, the weaknesses that we have in our health systems, and it has underlined how important healthy economies are, and they need to have, and they're dependent on healthy citizens. The pandemic has reminded us that the greatest challenges facing us today, from COVID-19 to antimicrobial resistance to climate change, are common ones. And we need to overcome them through collaboration and through solidarity. And I always say, and this is something that I have advocated for from many different platforms in different times in my life, that we can only bring about real change if we work in partnership. We need to have a shared vision for the future of Europe and for the future of health in Europe. And today's event is a perfect example of such a partnership, bringing together so many different stakeholders and experts that all together can help develop this vision. And having a vision, though, is not enough. We need to act, as you have very correctly said. Minister Spahn has also said this, and I wish him a quick recovery from COVID-19. And we need to act quickly and now. European citizens have, from the beginning, expected the EU to lead the response to this crisis, and rightfully so. They expected a high level of protection, and rightfully so. Coordination is vital, and we are mobilizing all the means at our disposal in order to support member states in tackling this coronavirus pandemic. This has also meant quick learning for all of us throughout this pandemic, and learning to work together and collectively and building up these partnerships in very many different ways. The pandemic has shown us that we have needed to build up, and we need to improve our preparedness and our quick response. We need to work more effectively across borders. Viruses know no borders, and this has accentuated the need for us to have this cross-border collaboration across the EU. As part of our COVID-19 health response, we will be presenting next month a proposal for a stronger and more comprehensive EU framework for preparedness, for surveillance, for risk assessment, and early warning response. We will be proposing, and you heard Minister Spahn also say this, a strengthening and a revision of the mandates of both ECDC and the European Medicines Agency. This is not to say they have not been doing a great work throughout the last 10 months, but it is also apparent that learning from this experience, we need to strengthen their mandates so into the future they can be more effective and have a more extensive mandate. We will be starting to build a European-style BARDA to oversee biomedical advanced research and development. These are proposals which are a real step change for the strengthening of the defenses that we need to have in order to protect our citizens from cross-border threats in the future. However, Minister Spahn has also mentioned it, that the way out of this pandemic is a safe and effective vaccine and therapeutics. These can be the only permanent solutions that we see at the moment. And we've been working very closely with member states for a truly European solution to this, working with advanced procurement under our EU vaccine strategy, hand in hand in our commitment that this pandemic is not an EU problem, it's a global problem, so we are committed for global solidarity if and when a vaccine is found. A few weeks ago, we presented recommendations on how prepared, what we need to be prepared. So when a safe and effective vaccine is found, member states need to have strategies in place so that they can immediately use it and deploy it to reach citizens as quickly as possible. And we already have come forward with a comment with our recommendations for this. I don't want to take up too much of the time, but there are certain points that I would like to pick up on. First of all, on the priority of cross-border healthcare. Over the past few months, we have seen how access to healthcare and access borders can be a lifeline to patients. And some member states have shown unbelievable levels of solidarity treating patients during the pandemic from neighboring countries. And there is a very clear lesson that needs to be learned here, that solidarity saves lives. Fragmentation does not. And we're taking concrete steps to ensure better access for patients in cross-border healthcare. We're working very closely with the EU health ministries to improve implementation of the cross-border healthcare directive, and we are ready to assist the coordination of intensive care places for patients using the European alert mechanism. Neighbors need to be able to support each other if they have the capacity, and they need to be able to share their expertise in terms of healthcare professionals and also their equipment. We have made 20 million euro available to co-fund the emergency transport of patients and medical personnel through the emergency support instrument. At the same time, we are supporting clinicians in the front line through the clinical management support system. And it has allowed over 600 clinicians located in over 250 hospitals in 28 countries to exchange knowledge and discuss cases. And this is vital in a pandemic that is unprecedented and a virus that we didn't know very much about. So we're working very closely with member states to achieve our cross-border interoperability of our contact tracing apps, but not only. And this is a crucial part of solidarity into the future. The second priority I want to touch upon is the future-proof health system. I think this is very important, and it has been mentioned, but I would like to highlight a few points. First of all, I don't speak about lessons learned from this crisis because we're still learning from this crisis, but there are important insights available that we can touch upon. Having a strong primary healthcare system is of paramount importance for the continuity of care for acute and chronic patients. And we have seen the importance of telemedicine in this situation. We need to pay more attention to vulnerable groups and need to address health inequalities. We need to have universal health coverage, and we need to invest in our health workforce. This is not something that we can take in any way lightly, but we need to look at this carefully. And I have had many opportunities to discuss with patient groups over the last few months. This was for myself a priority because it gave me an insight into how the pandemic has been impacting into their daily care. But I also had the opportunity to discuss with health professionals and see how they were impacted by this pandemic. So I think that we are learning continuously of what we need to do in the future to be more resilient, have stronger health systems. And of course, as outlined in your recommendations, we need to link the health data across the EU. We're working to build a European health data space in order to allow better health data exchanges, and this will really improve the level of care for patients across the European Union. So these are priorities that we have highlighted, and I'm leaving one last, but definitely not least. It was in my mandate from the beginning, coming forward with a proposal for a new pharmaceutical strategy. The issue of access to affordable medicines, to innovative medicines, to address medicine shortages is not one that was brought about by the pandemic. but the pandemic definitely accentuated the problems we knew were there. So we are coming forward in the next month, in November, with a pharmaceutical strategy for Europe, which aims to address these problems. And critically, the strategy will also be including measures to promote innovation in the EU, an issue that comes up in almost every call I have with different stakeholders. So I want to thank you all for the opportunity to share these thoughts and priorities with you. I want to assure you that our close cooperation is for us, for myself personally, a priority. I come from the, have been involved in patient advocacy for many, many years, and one learns that out of crisis come opportunities. And I believe that out of this crisis, we can have a stronger European Health Union. We need to address what European citizens are asking for us, and that is to give them a better level of protection in what concerns them most, which is their health. So this is our vision. We are putting forward these actions in the next month. These are not magical plans that are going to solve the problems in one day. I am very aware of that. Implementation is key. The actions will be looking for implementation over the coming years, and I look forward to exchanging thoughts with you and really count on your support so that we can work towards making Europe stronger in the area of health. Thank you very much. Thank you.
Commissioner, thank you very much indeed. Not magical plans. No, we accept that. Thank you very much for being with us. And normally at this point, I would try and give a little bit of a sum up of what the Commissioner was saying. But in fact, we have somebody who can do that a lot better than me in a visual way, because we're delighted that Christopher Malapitan is with us, who is a visual recorder. And he has, you might want to say and see this actually, Commissioner, has made a visual summary.
I am staying as long as I can.
Right. Well, Christopher's done a visual summary of some of the main points that you've made, and so we're very interested to see. But Christopher, first of all, before we look at what you've done, I mean, you've had to make the switch, one assumes, into this virtual world, as we all have. What are the challenges for you?
Oh, the biggest one is moving from analog to digital, of course.
Yeah, but, I mean, is it quicker to actually draw on in a digital way or not?
Well, obviously there is a bit of a learning curve, and I had to do the shift since March, so you could say I have had a bit of practice since then. Okay,
well, can we have a look at what you've done?
Sure.
We're going to put your slide on screen, and then we can have a little look. So real change happens in partnership, the Commissioner said. She talked about the need for vaccine strategy, global solidarity, universal health coverage, and I have to move a box to be able to see what part of it here. We must act now, and EU innovation, pharmaceutical strategy, all the important things. You've managed to capture a lot there in a short time. Is there anything we've missed here, Commissioner? You talked about, you talked about quick learning and that we're still learning, and I think that's something that strikes me, that people have had to move and be much more flexible because of of what's happened during COVID.
I think, well, what is happening because of COVID, I still use the present tense because we can see that this is an evolving situation. But what we're seeing with COVID is that it has impacted on every aspect of our lives. And I was very interested in what was mentioned before of the mental health aspect. That often goes unnoticed. And for myself as a mental health professional, this is a huge area. COVID has changed the way that the societies and economies work, the way that people relate, the way everyday life has changed. And we need to really be very aware of this when we're dealing with the everyday situation. But more than that, it is teaching us of what we need to have in place to build up a stronger Europe in the area of health. I believe that this is imperative, that the lessons we are learning we take forward so that we are able to meet similar challenges in the future, not only to be able to address them when they happen, but to work preventively and proactively. And citizens are expecting this from us. Thank you.
Well, thank you very much, Commissioner, for joining us and giving us this time. It's great to see you. Thank you.